Okay, good morning, everyone. It is 11 a.m. We're going to get started with our presentation today on affordable housing. I welcome you to our part 3 session of how to pay for senior housing and long-term care. If you have joined us on the other 2 sessions, the first few slides will be a repeat, but I'll try to go through them relatively quickly here. My name is Christine Drasher. I'm the marketing director at Emerald Crest Memory Care in Burnsville. We are one of 3 sponsors of today's session, and I'll be your host to walk you through the session and introduce our speaker, Sherry Eastgate. Just some quick information about Emerald Crest for those that are not aware of us. We are a memory care community tucked into a residential area right off of East Travelers Trail in Burnsville. We also have 3 other locations in the metro: Minnetonka, Shakopee, and Victoria. Our memory care is a small home-like setting that has 12 to 15 residents to a house. And we provide different levels of care in our memory care. So as you can see from that picture, that's what our houses look like. Our environments were built specifically for those with memory loss, and we have a really unique program that has occupational therapists and nurses who oversee the care plans of our individuals and really focus on the ability of our residents rather than their disabilities. We have different levels of memory care and in each house so that we can meet the resident needs where they're at and where they're functioning. Right there is all of our locations, and Elizabeth Wendell is our admissions director, and her pictures there along with her phone number and contact information if you're interested in learning more. Our second sponsor is Apple Valley Village. Jean Andres is the marketing director out there. And they have a beautiful campus. It's been in Apple Valley for many, many years and is pretty well known out in that area. They have all different levels of care, from independent living all the way to skilled nursing facility. They also have an open circle adult day program out there. And it's just a really nice, beautiful campus for that can meet a lot of needs. And her number will be on the last slide here if you want to reach out to her. Here are just some features of the village. They do have somebody always at the front desk 24/7, which is very reassuring for a lot of the residents and the families. So there's always somebody there to answer an emergency. They do have a chaplain on site that does a lot of different services and Bible studies and does one-on-one visits as well. And they have assisted living services available in all their apartments. So if you move in independent, you can stay within your apartment and receive services as needed. I'm not going to go through each one of these, but you can kind of get a feel for what they offer. Here are some of their amenities. They're located right real close to Cedar, and you can see they have a lot of different options of community spaces there for you. Our third co-sponsor is the Regent of Burnsville, and it's Kimberly Carpentier is the marketing director out there. The Regent of Burnsville was built in 2004. They are also another community that offers a lot of different levels of care, from independent living all the way to care suites. They are located right or very close to the Burnsville Mall and right on Lake Early. So it's a really pretty area that is right off of the lake there. Majority of their apartments have that nice view of the lake and have access to the walking path. They also have a lot of different amenities. As you can see there, they have a lot of different social and spiritual, recreational, educational, and wellness focused programs. They have a lot of different community spaces, including the movie theater. They have a wonderful dining room that is open 7 days a week and is more of a not necessarily a scheduled meals. You can go in and you can kind of have open dining all day long. They have transportation, 24-hour emergency call, and they do also welcome pets. Some of their apartments amenities are listed here for you. Many of them do have washers and dryers in the apartments, and they do have personal care staff there 24 hours a day as well. Another feature, just like the Apple Valley Village, is if you move into an apartment as independent and you start needing more services, you can remain there in that apartment, which is very nice. So their assisted living can be within all of the apartments. So if you're interested in any of those units, I definitely would reach out to that, or any of those communities, I'd reach out to them and set up a time to visit with them and learn more of each of their locations. We're going to move on to introducing our speaker today, Sherry Eastgate. Sherry Eastgate is the Director of HUD Housing and the Office Manager at Apple Valley Villages. Sherry has worked at Apple Valley since 1987 as what is certified as an assisted housing manager in 93, and then in 2012 she was certified as the HUD subsidized multifamily housing manager. Sherry completed her certified senior advisory training through the Society of Certified Senior Advisors in 2010. And since 1993, Sherry has managed the HUD program for the 72 HUD units at Apple Valley Village, assisting residents and their families to obtain and maintain their HUD subsidy, as well as working with the county caseworkers to set up their services provided through the Alternative Care Grant, Elderly Waiver, CADI, and MA. Before I have Sherry take over here, I'm just going to mention that we will offer up time at the end of this presentation to do questions. So if you can hold on to your questions until that time, remain on mute until that time. And then as we get to the end of our presentation, you can do questions a couple different ways. You can go ahead and type them into the chat room, and I'll just read off the questions and we'll address them there. Or you can put your name, just list your name there, and then I will call upon you and you can unmute yourself and ask the question yourself. So we'll do it either one of those ways. All right, so we're going to get moving forward here, and I'm going to pass on to Sherry. So please welcome Sherry Eastgate, and thank you very much.
Good morning, everybody. I hope you're enjoying this nice day. I'm just going to make a few comments before I move on to the slideshow presentation. I just want to clarify that my experience is derived from the 35 years that I've spent here at the Apple Valley Villa, and how our HUD program specifically works, and how the county programs that are available work here at the Apple Valley Villa. I've provided a lot of other information in the late slides in my presentation that are for you to use when you are looking at what all of your options are going to be. I'm happy to answer questions at the end of the presentation, with the understanding that if you're more comfortable talking about specific financial or personal needs questions, I would encourage you to either call me or email me, and we can talk about those in a more private setting. A lot of people don't want to discuss those kinds of things on a public forum like this. So I'm happy to answer general questions at the end, but if you want to ask more specific questions, feel free to give me a call. First of all, I'd like to really encourage people to get on as many waiting lists for, if you're specifically looking for subsidized housing, make sure that you get on as many lists as you can and as early as you can. The wait lists at almost all subsidized properties are very long. Our HUD waiting list is, I have 100 people on my waiting list, and our minimum wait time is a minimum of 2 to 4 years, depending on where you fall within the income limits, which we'll get into in a little bit. I can't tell you how many phone calls I get per week from people who are desperate and who are in a crisis situation and need housing right away. And under the subsidized program, I have very strict rules, and I have to follow my waiting list. And so it's very hard to hear those phone calls and stuff. So I just encourage you to get on as many lists as soon as you can, and have those options available to you when it comes your time to make a move, when you decide you want to make a move. I would also encourage you to start touring facilities or properties as soon as you can. And because once you've seen one property, you've seen one property. We're all different. We all have different services. We have different amenities. We have different ways of providing services and different ways of getting those services paid for. So it's very important that you take the time and see as many properties as you can and find out what feels like home to you and what is going to be the best long-term fit for you so that you're not having to make move after move after move to meet the needs for whatever needs you might have. Apple Valley Villa is one of the only HUD Section 8 properties that I'm aware of in the area that has assisted living services right on site. We have our own CNAs, our own nurses right on site. That's pretty uncommon, as well as having a full campus. We have adult day, memory care, care suites. We have our long-term care facility and a TCU for short-term stays right next door, which is connected right to our building, which is really nice, especially for married couples. So if one person does need to be in the short-term stay after a surgery or a fall or something like that, their other loved one can easily go visit them without having to arrange transportation. And that's very unique to our property, which is really a nice thing. The other nice thing about the villa, because we are such a large property, you can be as independent and private as you want, or be as involved as you want to be, and have all of the services that you might need provided to you right in your own apartment without having to make a move until it's absolutely necessary. So those are kind of my first points. We'll go ahead and move to the next slide, and I'll start with my presentation. So today we're going to talk about the HUD Section 8 and the housing urban development types of subsidy, which are project-based subsidy and tenant-based subsidy. And we're going to talk a bit about alternative care, elderly waiver, and medical assistance. So specifically, Section 8, there are two types of subsidy that I'll be talking about today. One is project-based subsidy, and that is what the villa is. We have a project-based HUD contract for 72 units. So we have a total of 210 units here at the villa. 72 of those are HUD subsidized. They are spread throughout the whole building. They are all one bedrooms, but nobody knows which units are HUD and which ones are market rate. So if you're in a HUD unit here, nobody's going to know that unless you share that with them. Under the project-based subsidy, that means that the subsidy is with the property and with our individual apartments. So if you decide to move out, you don't take your subsidy with you. It stays with the apartment. And under our program, you will pay 30% of your gross income is what your rent will be. The other type of subsidy is tenant-based subsidy, which is through the Housing Choice Voucher program. The CDA, Community Development Agency, manages that program here in Dakota County. And under that program, you get on their waiting list, and they'll call you up and say your name has come up. You now have a voucher, and you can take that voucher anywhere that will accept that voucher. Unfortunately, you can't use a tenant-based voucher here at the villa. Because we have so many things built into our market rate rent, like the 24-hour staffing at the front desk, and we have an on-site social worker and a full-time activities director. All of those kinds of things are built into our rent. So you can't use that here, but you can take it to any other property in Dakota County that will accept that voucher. Under the tenant-based subsidy, you will pay 40% of your gross income is what your rent of your adjusted gross income for your rent. So typically it's going to be a little bit more than what you'll pay under our project-based subsidy. So those are the two key differences between the two types of subsidy. Specifically here at the villa, Again, we have 210 units, 72 are HUD subsidized. My wait list is a minimum of 2 to 4 years long, depending on where you fall within the income limits. So our income limits just went up April 1st. And so to qualify to be on our HUD waiting list, your gross income needs to be below $41,100. And when we're talking about gross income, that's the amount before they take out Medicare or any supplemental health insurance. So it can't be just the amount that hits the bank, it has to be that gross amount. And if your gross income is below $24,650, you would be considered extremely low. And in that case, you would be looking at a minimum of a 2-year wait. If you're between the 41,100 and the 24,650, that's when you're looking at a very minimum of a 4-year wait. The way our wait list works here at the villa, I have 100 people on my waiting list. The first 25 people already live here. So the other 75 they live in the community yet. And when I have a HUD unit that becomes available, the first one will go to somebody who lives here and already lives in the building. The next unit will go to somebody from the outside. So if you're able to move into the villa market rate, it'll cut your wait time in about half. So instead of 1 to 2 years, or instead of 2 to 4 years, you would be looking at 1 to 2 years. So there is quite a wait, and that's why I encourage people, get on those lists as soon as you can. Here at the villa, if I call you up and say your name has come up and you're not ready to make a move yet, doesn't affect your placement on the wait list. You tell me you just want to stay on it, and I'll call you back the next time your name comes up. So it doesn't cost anything to be on the wait list. So I encourage people, get on the list sooner rather than later. It's a backup plan for you. So, and you don't want to be in that crisis situation and not have any options. When you're filling out the HUD application, and either the HUD application or later in the presentation when we're talking about the programs through the county, make sure that you're filling out everything completely and that you're providing all the documentation that we're asking for. It just helps keep everything moving, and especially in the county cases, they have huge caseloads and they're working with a lot of people, and you don't want your case to get closed and you have to start the whole process over. So just make sure that you're providing everything that we're asking for and getting that to us as quickly as you possibly can. Your placement on the wait list here at the villa is determined by the date and time you get your completed application back, and I can get it entered into the system. Couple things to keep in mind. We are a 62 plus community, so you have to be at least 62 years of age to even be placed on the HUD wait list. So if you're 61, I can't put you on the wait list until you're 62. So you can't start that process with us until you do turn 62 years of age, and we are a smoke-free property. So that's kind of the HUD wait list and how it works here at the villa. So the next few slides, or the rest of the slides, are information that I share that's right off the internet, and it's meant for to provide you talking topics when you are dealing with a professional Medicaid planner, an elder law attorney, estate planning attorney, your county financial workers and caseworkers, and most importantly, your family. I really encourage you that as you're working through these processes, to include your family, take them with on the tours, have them there when you're doing these phone calls. The more ears on the situation, the better. When you're talking to myself or the county caseworkers and stuff, it's a lot of information. It gets it can be very complicated, and it's just a lot of information at one time. So if you have family members or loved ones there with you, you might hear one thing, someone else will hear another thing. So it's good to have them involved from the get-go and include them on that whole process so that they can help you through that. So again, this is all information that you should use when you're talking specifically to your county caseworker or financial workers, and to have them help you through this process. So the next slide, the alternative care program. I'm going to talk a bit about how the two different programs work here at the Apple Valley Villa. For alternative care at the villa can be used to pay for 1 meal a day and housekeeping and laundry. You can also use outside services to provide nursing care, so a home health and outside home health agency. We have a contract with the county for alternative care, but it only covers our meal program and our housekeeping programs. But you can also use alternative care if you're still in your own home. And there's, it can be used for PCAs and nursing services and adult day services and household chores and things like that. So the alternative care program is kind of that first option that's out there to help you make your money stretch just a little bit farther. To qualify for alternative care, you have to be at least 65 years of age or older. So here at the villa, if you're between 62 and 65, you could potentially be covered under the CADI waiver. I didn't put any information in here about CADI. We don't see a lot of that here, but we do have a few people. But a lot of the program requirements, the things that they can do are the same as the elderly waiver program, which we'll talk about next. So for alternative care, you do have to be at least 65 years of age. And then elderly waiver is the next program for the villa here to be able to use that. You can use it for up to 3 meals a day. We do offer breakfast, lunch, and dinner, and you can choose to have 1, 2, or 3 meals a day, and the elderly waiver will cover those for you along with housekeeping and laundry. And then you can also use that for any nursing services through our nursing program to have our nurses help you out or our CNAs help you out right in your apartment. You can still use the elderly waiver and have outside services if you prefer from a home health agency. But the nice thing is we have our own nurses, our own CNAs, we have our full-time housekeepers. So you typically will have the same staff over and over again, which is really nice and really helpful. Again, the elderly waiver program you can use in your own home as well. So it's still a good program to check into. And again, with the elderly waiver, you do have to be 65 years of age, just like with alternative care. So if you're on the CADI waiver now, once you turn 65, typically you move over to the elderly waiver program, unless the county determines that you should stay with CADI. So the elderly waiver just helps you stretch your money, helps you get the services you need or want, and the county caseworkers work with you to determine what you need and who's going to provide it. The next slide is kind of it's just a chart, and it tells you what elderly waiver and alternative care can pay for. There's a whole variety of services. And so it is really beneficial to you, even if you're still in your own home. And then the next 2 slides are the income and asset limits for the elderly waiver and medical assistance programs. And I want to clarify that these are the 2022 limits that I found online. And so as far as I know, those are accurate. I tell people make sure that you call the county and verify those. They do change. Like I said, ours here for our HUD program just changed April 1st. So, but these were listed as the 2022 income and asset limits. And so this is information so that you can read through it, see if you qualify. And if you're unsure, you're going to call the county caseworker or county intake number, and talk through that process with them. And their number is listed later on in the presentation. I do want to point out that on this on this slide, for the asset limits for MA, you can have $3,000 per person. So if you're a married couple, you can each have $3,000 in assets. They do have a look back period of 5 years, where the HUD look back period is only 2 years. So you have to make sure that you're not giving away money, assets. You can't give away a home or a car, that you could have gotten money to pay for your own services and stuff. And the county really looks back at that stuff. So you're going to want to make sure that you're really tracking anything, any of your assets that you're holding that you could potentially use to sell and have money for more of your services. So they look back 5 years, and they really do look back at that. So the next, the other thing is there are ways working through estate planning attorneys or elder law attorneys to help you protect your assets, your home, and things like that. And so these are talking points for you when you're working with a professional Medicaid planner, an estate attorney, when you're working with your county financial workers, and to talk through these things with your family so that they can research different programs, different ways that you can protect some of your assets. So that's what the home ownership slide is about. The next one is how you qualify if you're over asset limits. You would end up with a medical spend down or a waiver obligation. And so you would be paying for part of your services, and then the county would be paying part. So that talks through what those limits are and how you qualify for that. And along with the next slide as well, they list different programs and different things that you can talk about with those professionals. There are irrevocable trusts, spousal asset transfers, annuities, spend down of excess assets, spousal refusal, medical assistance protection trust. So there's a lot of different types of programs and ways that you can still qualify and get some assistance so that you're not, so that you can help stay in your home a little bit longer. So we're going to go to the next slide. And that again is the home protection strategies. There's the ladybird deeds, child caregiver exceptions, and siblings exceptions. So those are all just things that you can research online or meet with those professionals that I mentioned to see if any of those things can help you. The next slide is contact information for the different county programs. So listed, the first thing there is the Dakota County intake number. So you can call that number and talk about the alternative care program, elderly waiver program, any of that kind of information they'll be able to help you with. And another really good contact for you is the senior linkage line, and that number is listed there. If you're really not sure of what's out there or what would be best for you, that's what the senior linkage line is for. They can help you determine what you could get in your own home, or help you find facilities like ours or Emerald Crest or any of the others that would be able to provide you with the type of services that you need. And then I've listed a bunch of other assistance programs that that are available that aren't as well known, The biggest one that we see here at the Villa is the Energy Assistance Program. It helps you pay for your electric bill here at the Villa. And so there's another application for that. But it is a really good program that does help a lot of our residents meet some of those needs. And then there's just a whole list of other different county programs or assistance programs, from helping with heating and food. You can get help with SNAP and things like that. So all of those programs are listed there with contact information. And then two other really good resources are the Senior Housing Directory and the Senior Housing Guide. They're two magazines that really we advertise in both of those magazines, and they break everything out by independent living, market rates, subsidized, memory care, care suites. They break it all down, and you can get a nice view of what each property that advertises in the book, what they provide and what they don't have. So it gives you a place to start. And so they are a really good resource. And I think you can get those at like Cub Foods and stuff, but otherwise, if you contact us, we have copies that we're happy to share. The next slide is a list of the Dakota County subsidized properties that advertise in both of those magazines with us. So each of these are project-based subsidies. So they have their own HUD contracts, and so they have their own wait list. So each of these properties, you would need to contact them, get their application and get on their waiting list individually. And then at the very bottom is the Dakota County Community Development Agency, which manages the Housing Choice Voucher Program. So that, as far as I know, their wait list is still open at this time. They do open and close theirs frequently, so but there's their phone number. And they have 30 plus properties in Dakota County alone. And so once you call and you get their application and get on their wait list for the Housing Choice Voucher, you can get into any of those 30 properties that have openings. So that's one application where with all of our other ones, you have to fill out an individual one for each of our properties. And that actually is about all I have. Again, I just want to really, I can't stress enough to get out there, see what's available to you, and get on as many wait lists as you can now. Again, there's a huge shortage of subsidized housing, and everybody's wait lists are really long. So you just don't want to be in a position where you are in a crisis and you need housing fast, because it's going to be very hard to find. So.
Thank you, Sherry. I want to note here, your phone number is listed on this slide under the Apple Valley Villa, 952-236-2610. So if you want to talk to Sherry in person, that is her number. And then on this slide, we have her email as well as my email. So if you have any questions for either of us, you can definitely reach out that way. So at this time, we will open up to any questions people have. Go ahead and open the chat room. You can type in your question or mention your name and we can call upon you as well. So we'll see if we have any. So it says, what's the phone number for the Housing Choice Voucher? It seems to be missing a number. So let's go back to that slide and see what we got. So it's 651-675, and you're right, we are missing a number. It's 440, and we're missing the last number, I think.
Let's see here.
Good catch, Cindy.
Yeah, sorry about that. Let's see. I'll continue to look and see if I can find that.
That's fine.
So.
Another question Cindy had was in the beginning, mentioned the region of Burnsville. Does that facility accept Section 8? I can answer that. It does not accept Section 8. However, they do accept elderly waiver and caddy. So if you're at a point where you need assistance, then those would be the programs you can apply for there.
Okay, so that phone number is 4400. So 4400. We missed a 0 at the end.
Okay, so we'll correct that on the slide. And what I'll be doing is I'll be sending out the handouts, the corrected version to everybody who's on this presentation participating and who signed up. So you will receive that probably within the week. And I'll also have a link to the video of it as well. Good. Thanks, Cindy. Any other questions? Give it a few more seconds here. Kim has, if a resident is already at Emerald Crest, does that automatically put them on the waiting list for subsidized housing when they need help? So at Emerald Crest, that is the same as the region. They don't have the subsidized, but they have, they do work with elderly waiver. And yes, as they, just like many places, if you start off as market rate or paying privately, you generally get kind of the first, you kind of bump up ahead of anybody else who is not living there currently. And so you will be able to probably receive those services ahead of others. So that puts you in a much better spot. What is the Burnsville location phone number? Carol, I just need to know, are you looking for the Burnsville Regent or the Burnsville Emerald Crest? And then I will respond to your email or to your chat. Okay. So the Regent phone number is 952-898-1910, and that is the main number, and they can transfer you to Kimberly to get more information.
And I'm going to just mention as well, for anybody that might be on that has loved ones at any of the CASIA sites, we do give that in-house preference to anybody that is already within our CASIA family. So if you're at one of the typically you wouldn't be coming from Emerald Crest to us, but if you're at the Regent or one of the other properties, you still have to fill out the application. You still have to get on the wait list, but you would be moved up to that in-house portion of the wait list. And so your wait time would be shorter than, again, somebody living in the community. So
good. That's great to mention. Thank you. Good questions. Kim would like to know, or I'm sorry, the question is, how do I get on the Apple Valley wait list?
Yep, so go ahead and give me a phone call or email me. And I just need either your email address. I can email you out our whole application packet, or I can place it in the mail to you, whichever works best for you. So my email address is listed right there on the slide on the screen. Or again, my direct line is 952-236-2610.
Thanks, Carol, for those questions. All right, I don't see any other questions coming through. So I think we will wrap things up here. Again, you have the email and you have the phone number. If you do come up with questions later on, and you'll receive a follow-up email from me within a week with the handouts, contact information, and link to the video in case you'd like to listen to it again. So thank you all for joining us. I hope you have a wonderful day. The sun is out. Go enjoy it. And thanks, Sherry, for all that wonderful information.
Thank you, everybody. Have a good day.
Yes, bye-bye.